Okay, this is our Social Work 728 group intervention demonstration. The group members are Carson Inslee, Jesse Faircloth, and Rachel Hebron. So our case study is over June. June is 22 years old. Her identified gender is female. Her race and ethnicity is Caucasian, and there were no modifications made to this intervention. June's DSM-5 diagnosis is generalized anxiety disorder. June reports experiencing anxiety over the past 12 months. She reports difficulty controlling her anxiety. She reports restlessness as evidenced by pacing around her apartment when feeling anxious. She reports difficulty concentrating on work tasks at the bar in which she works, rigidity and tenseness in her body, and she also reports not being able to sleep due to her anxiety. June exhibits 4 of the 6 criteria for generalized anxiety disorder. The 4 symptoms that June exhibits are restlessness, difficulty concentrating, muscle tension, and sleep disturbance. The client strengths that we identified for June: number 1, June has a childhood friend named Rebecca. Number 2, June has a job and she reports that she is able to support herself independently. June also has a close relationship with her mother that has grown over the years, and she's also very close with her older sister, Morgan. And the 4th is that June is self-aware and she identifies that she needs help developing coping skills for her anxiety, and she's agreeable to treatment. June's growth areas that we identified. Number 1, June's boss has noticed that her symptoms of anxiety are affecting her performance at work, so she may now be at risk of losing her job. June also has a difficult time trusting others. June reports that she spends a limited amount of time interacting with others due to her anxiety. And June has also not been able to get a sufficient amount of sleep due to her anxiety.
The first treatment plan goal is to develop a present moment focus through mindfulness coaching to cope with anxious thoughts within the first month of therapy, as evidenced by client reports and therapist reports. The first objective is that the client will engage in daily mindfulness homework, such as 5-minute present moment focus guided meditation, and report to therapists on a weekly basis about her experience with present moment focus. The first intervention is within the first 3 therapeutic sessions. The therapist will provide psychoeducation about present moment focus and provide mindfulness activities for the client to complete as homework. The second treatment plan goal is that the client would like to become more self-aware and will identify and clarify client values within 4 sessions. The second objective is that the client will engage in reflecting about personal values for a minimum of 15 minutes within 4 therapy sessions per client and therapist report. And the second intervention is that the therapist will ask the client questions to promote reflection about values within 4 therapy sessions for at least 20 minutes. The therapist will provide psychoeducation about values and the difference between a value and a goal within the first therapeutic session. The third treatment plan goal is that the client would like to reduce intensity, prevalence, and number of anxiety symptoms to improve her overall well-being over the next 6 months. The third objective is that the client will utilize mindfulness grounding techniques at least 4 times a week to cope with symptoms of anxiety per client report. And the third intervention is that the therapist will coach the client through grounding techniques at least once a session for the duration of treatment and provide handouts for mindfulness techniques to utilize throughout the week. So for intervention, we chose acceptance and commitment therapy. Specifically, we decided to focus on cognitive diffusion, which is an integral part of ACT therapy, in which the client recognizes a separation between thoughts, beliefs, and feelings. This process builds on tenets of ACT, such as acceptance and mindfulness. This was chosen to be supportive for June's case, as her thoughts are impacting her anxiety, as well as influencing negative beliefs about herself. Throughout this intervention, we used open-ended questions, summarization, reflection, clarification, and empathy to engage with June. So the setting that this role play is taking place is at a community mental health agency in Atlanta, Georgia, in which clients do not have to pay for services. A licensed clinical social worker has been working with June for the past 2 weeks using ACT therapy, and they have established some rapport. The stage of the intervention is to understand cognitive diffusion and its role in self-acceptance. The goal of this session is that June will identify 3 thoughts and feelings surrounding anxiety she experiences and discuss applying cognitive diffusion and ultimately self-acceptance. Hi, June. It's nice to see you again. How have you been over the past week since I last saw you?
Hey, I'm glad I made it here. The past week has been pretty difficult for me. I feel like a giant ball of anxiety.
Okay. I hear that you've been feeling anxious. Is there something in particular that's causing you anxiety? Any thoughts or beliefs?
It is a bit hard to explain because all of the thoughts feel tangled up in my head. Where should I start?
Let's start with today, if that sounds okay with you. What kind of thoughts have you been having today when you start feeling anxious?
Well, as soon as I woke up, I was thinking about my shift at work last night. As you know, sometimes at work I get overwhelmed with anxiety and start to forget people's orders. Last night, I brought a table in the entirely wrong order, and my boss took me off the floor and I did side work for the rest of the night. He asked if I was on something, which made me even more worried that he thinks I'm using substances at work. Then this morning, I started worrying that I will never be able to do something right and that my anxiety will never get better. Have you ever heard of someone having anxiety about their anxiety?
Yeah, I have. Anxiety has a funny way of doing that. Um, I'm hearing that you're feeling anxious about your performance at work last night, and a belief associated with that thought is that you can't do anything right. Am I understanding you?
Yes, you are.
Okay, good. Last week, we talked about the process of acceptance being the ability to accept events that happen in our lives, such as having a rough night at work, and viewing them neither as negative or positive, but as something that happened. What would acceptance look like for you in this situation?
Mm, Let me think. I guess acceptance for last night would look like acknowledging that it happened, but not avoiding it or wanting to change what happened.
Okay. Yeah, I appreciate your self awareness and reflection in discussing this. This week, I would like us to talk about the process of cognitive diffusion. I know the term cognitive diffusion is a little bit intimidating and clinical, but we'll break it down together. Does that sound okay to you?
Yes, that sounds okay to me.
Okay. I will explain the concept to you, and if you have any questions, I'm happy to answer them. This is all for the purpose of helping you navigate anxiety. So, cognitive diffusion is the process of untangling thoughts and feelings to bring awareness and clarity. This is helpful when our thoughts dictate how we're feeling. Ultimately, thoughts that bring about anxiety aren't the problem. It's the way that we relate to the thoughts that cause us to feel uncomfortable. When we think about the word fusion, it's about 2 things being fused together. In this situation, it's the thought and the emotion or belief that are fused together. In your situation, the thought, I didn't do well yesterday, is fused with the belief that you can't do anything right. Through the process of cognitive diffusion, we can begin to defuse these thoughts, beliefs, and emotions, which can help us accept the things we cannot change and notice our thoughts without reacting to them. Does this make sense, or do you have any questions?
Yes, that makes sense. I just have one question. Is it my fault that I'm fusing these things together?
That's a really good question. We all play a role in our reaction to our own thoughts, but it's completely human to fuse our thoughts, emotions, and beliefs. That's why this form of therapy was developed to help people like you and me grow to accept ourselves and create distance with our thoughts.
That makes sense. So, how do I do this cognitive diffusion?
Yeah, so we're just building off what we talked about last week surrounding mindfulness. In your own words, how would you describe being mindful?
I would say that being mindful means having awareness of the present moment, including where my body is and sensory wise, what is happening in the moment.
Yes, that's a great definition. So, cognitive diffusion is going to build off of the process of mindfulness. When we look at our thoughts instead of from our thoughts, awareness starts to build. When we notice our thoughts instead of being caught up in them, it's easier to let them go. It also becomes easier to recognize when you are believing your thoughts as beliefs versus just noticing them, accepting that you are having these thoughts and letting it go. It's like watching the clouds pass in the sky, except the clouds are your thoughts and you are the sky. Let's identify some more thoughts that are fused with emotions or beliefs, and then we'll diffuse them.
I think that makes sense. Well, another thought I had today was that I am terrible at socializing with my coworkers. And then this led me to believe that I still can't do anything right.
Okay. Thank you for sharing that with me. So it sounds like you had a thought reflecting about socializing with a coworker and it being connected to the belief that you can't do anything right. If you were to notice this thought, what would that look like?
Yes, that's it. When I was experiencing this thought, I could notice it and then choose to believe it or not. It could just be a thought instead of meaning I can't do anything right.
Wow, June, you're already so good at this. Do you think you could invite this practice into your life when you aren't in this therapy office?
I think so. Do you have any activities that can help?
Yes. There are some questions that I'll write down for you on a note card that you can keep with you when you're at home or out and about. These are good questions to ask yourself. Is holding on to your thought or belief helpful? Is holding on to this thought or belief hurting you or causing you distress? Are these thoughts influencing the way that you're feeling? Also, you can use the label noticing when thinking your thoughts. Instead of thinking, I can't do anything right, try thinking, I am noticing that I'm having a thought that I can't do anything right. This can help us lead in the direction of self acceptance, which we will talk more about next week. Let's try this one more time. Can you tell me a thought you're having now?
Yes. Well, I'm noticing that I'm having a thought about dreading going to work tonight. However, I am trying to accept that thought instead of avoiding it.
That's great, June. I think you're really understanding cognitive diffusion and how it might be helpful for your anxiety. For homework, please write down a thought that you have noticed and any beliefs you have attached to that thought. Is there anything else you want to talk about today?
I don't think so. Thank you. I'll see you next week.
Thanks, June. I will see you next week, and remember to be mindful and gentle with yourself.
This is a handout. It is a exercise used in ACT therapy. It's referenced to as like notice 5 things. So about this exercise, this is a simple exercise to center yourself. When you find yourself getting caught up in your feelings and emotions, you can use this easy exercise. So it has 5 steps, and the first thing you do, you pause for a moment. Second, you look around and notice 5 things that you can see. Like it could be like my shirt, the computer, you just notice 5 things. Third, you listen carefully and notice 5 things that you can hear. So like right now I can hear a fan, and then so on. Number four, you notice 5 things that you can feel in contact with your body. So it could be if you have a watch on your wrist, your pants against your legs, the air on your face, your feet on the floor, or your back against a chair. And then number five, finally, do all of the above over and over again. So whenever you're noticing 5 things and you're trying to pick things out of what's around you and your surroundings, you're able to focus more on that than the thoughts or feelings that you were experiencing prior. That can sometimes weigh us down. The next handout is all about acceptance and commitment therapy, ACT therapy. A simple breakdown of this is just ACT, the A meaning accept your thoughts and feelings and be present present. C, choose a value direction. T, take action. Things to keep in mind. ACT therapy has two very important components. One being value guided action and two, mindful action. As far as the action, values guide, motivate, and inspire us to change our behavior. So we need to be mindful, fully aware, intentional, and fully engage ourselves in all of these experiences. 6 core principles would be cognitive diffusion, learning to perceive thoughts and images, emotions, etc., for what they are, not what they appear to be. Acceptance, allowing thoughts to come and go without struggling. Being present, awareness and openness to the here and now, observing the self, accessing a transcendent sense to self, values, discovering what is important to one's true self, and committed action, setting goals according to values and carrying them out. This last handout or worksheet, this worksheet is the Cloud Watching Cognitive Diffusion worksheet. The instructions say fill in a cloud with words or pictures of a thought that you experience, then connect the cloud to a raindrop of a belief or feeling attached to this thought. And then there's the cloud. You see the arrow as it exits down to a raindrop. And then lastly, here is a video for guided meditation exercises for mindfulness.